Hi guys, my name is Ruslan, and if you're here, you probably typed trigeminal neuralgia and multiple sclerosis because either you or someone you know has it. And I can tell you about this because I am currently experiencing it. I got trigeminal neuralgia about a month ago. It started all with very small discharges in the right side of my eye right here. Just like discharge once a day, then nothing for a few days, and then it would happen again. And at first I ignored it, and then I thought it would go away. Um, but then it would start happening a couple times a day for a second, and then it would start happening a few times a day for 2, 3 seconds, and then it would start happening for 10 seconds. And this is when I was really concerned, but I still hoped that it would go away because it just happened out of blue. Well, not really out of blue, because 7 years ago I woke up with numbness of the roof of my mouth on the left, and it's still numb. And I didn't know at that time, but I must have already had multiple sclerosis. I got diagnosed only 2.5 years ago because of my eyesight, a common symptom. But I know that that was the first symptom of multiple sclerosis. And I googled a numbness of the roof of your mouth, and trigeminal nerve came up. And I researched what possible conditions trigeminal nerve might mean, and that brought me to trigeminal neuralgia. When I read it, I was scared. I was really scared, and I was hoping that thing would never happen to me. But it happened to me, as you can see. And it happens not just to a few people like me, it happens to 100,000, 150,000 people in the US every year. Out of those 150,000, 90% are due to classical um, trigeminal neuralgia, which means it's a compression of the artery, which is pressing on trigeminal nerve, and that can be remedied with decompression surgery for most cases, hopefully. And like I said, that's 90%, but the other 10% is idiosymptomatic trigeminal neuralgia, and it comprises trigeminal neuralgia secondary to MS. So MS can also cause lesions which press on trigeminal nerve or which damage it, and that results in these symptoms. Out of MS patients, about 2 or 4 or 6% of MSers have this, much larger population than among normal population. However, it's also a minority. So if this happened to you, I'm really sorry, um, but I can share my experience. So what happened to me? That pain grew in intensity to about 1 or 2 minutes a day, and this is the scary part. It would start waking me up. I went to sleep, and it woke me up at 5:30 a.m. with pain, and I had nightmare. I was thinking that my head was melting and bubbling up, and I wake up and I don't understand what's going on, and then I wake up and I understand that the attack was happening. So the next night, and I remember this was September 8th of 2021, and the next night, to September 9th, I go to sleep, and I think, well, if it happened then, it probably won't happen now. And wrong. It happened that morning at 5:50 a.m. I wake up and I didn't sleep much, as you can guess, as you can see, and I'm super, super terrified. Um, and I noticed one thing, that when I relax, this is when it usually happens. So for some reason, these nerve fibers, they work in such a way that when I relax, my muscles trigger them. And so I was afraid to relax. I was tense all day long, and as long as I'm tense, it's not happening. So it's like torture, because it doesn't let you relax. And as soon as you relax, it happens again. That makes you not relax, and then you. I mean, you can imagine. So the next night I didn't sleep out of fear. And thankfully it was Monday when I called my office, my MS office. I actually messaged them, and they called me back, and I talked to a neurologist over the phone, and I described my symptoms, and they diagnosed me with trigeminal neuralgia, and they prescribed me uh, carbamazepine, which is also called Tegretol. So I get it, and I get on 200 milligrams at night and 200 milligrams in the morning. And at first, it worked. It worked very well for a number of days, 2 or 3 days. And then it was enough. It was not enough. Actually, it was enough at first, so I went down. On the fourth day, I went down to 100 in the morning and still 200 in the evening, because I was afraid that I needed sleep. And what happened was, it wasn't enough anymore. It would start hurting during the day. Actually, on one of these days, um, I went to a restaurant to eat with a friend, and as we were eating, I was chewing, and that's when pain happened. For the first time, it happened on chewing. Before then, it was happening just because, just randomly. And so now I had no doubt, because the a description of trigeminal neuralgia is if there are triggers such as chewing or touching your skin, something like that. So that was now official to me. Very depressing moment, of course, but that was that, and it was not helping. So I increased my dosage to 500 a day, and that was good for a while. And that was not enough. I increased it to 800, and on one day it was as bad as having to have a pill every 2 hours. So that brought it up to 1000 milligrams. So right now I am a little bit less. My symptoms yesterday and today were better, and I hope that this would kind of stop and not require me having more. But anyways, that's my story, and I wanted to also tell you, if you're a new patient or someone needs this information, I already said that among general population, this is extremely rare, and among MS patients, you're about 2 or 4%, and among trigeminal neuralgia population, you're about, less than 10%. So we are in the minority. Our symptoms are not that much different from what others have. For me, I only have it in this area, but I cannot speak from long experience. I only had this for a month. Um, and I've joined a number of trigeminal neuralgia groups, and I asked people questions about MS and this pain, and I talked to a number of MSers, and there are people, and they confirm that this thing wakes them up sometimes, that that they struggle with it, and a lot of them are on medications. But a lot of these people, of MS people, are also on medications for years and on not heavy dosage. One gentleman I've talked to, he is on 600 milligram of gabapentin, and he's been on it for a number of years. And I'll tell you, gabapentin is not a strong drug. It doesn't have much side effects, and it's not big. So that works for him. And then a friend of mine who I know has this. She is on 200 and 200. Now she switched to 300 and 300 of Tegretol. Um, and when I say 300, I mean morning and evening. And that is probably not very, I mean, you will feel it, but it's still pretty manageable. Um, so there are people who manage this disease on medications for years and years. And now, how what what treatments are there? Well, there are medications, and that is the first line of defense. And then there are surgeries. When medication no longer work, or they cause too much side effects, there are surgeries. There is gamma knife, where they put a helmet on you and they put you in the machine, and high frequency radiation beam shoots, and it causes damage to trigeminal nerve in the brain. Um, uh, so that has a success rate of about 80-90%, so a good success rate, and it works for about 5 years, maybe less. So that's a pretty good one. And then CyberKnife is the same thing, except instead of putting the head set, a robotic arm moves around and does that instead. I heard that CyberKnife is better in some reason, probably better experience for a person undergoing the surgery. Then there is also rhizotomy, and this is a injection under the skin, and it's also targeting trigeminal nerve, but outside of the skull. And they put either triglycerol to kill that some part of the nerve, or they put a balloon, which also causes damage. So with these surgeries, I have to say this, there are side effects sometimes, and sometimes it can make things worse. But in the large majority, it makes things better. So that's it, probably. If you want to, also, there are resources such as Facial Pain Association. This is where you can get on support groups. I've been on a couple, where you can talk to people with trigeminal neuralgia. Helps very much. On Facebook, there are many, about 6, 7, or even more trigeminal neuralgia groups. You can get yourself added. And I also created a group for trigeminal neuralgia and MS. If you want to check it out, It's called Trigeminal Neuralgia secondary to MS. That's all. Thank you for listening. Hope you have a good day. God bless.